Welcome to Diversity and Inclusion on Air's podcast. This podcast is a program of the Association of American Veterinary Medical Colleges Diversity Matters Initiative. The podcast explores various issues related to diversity and inclusion in the veterinary profession and provides the AAVMC an opportunity to offer ongoing diversity programming to our member institutions as well as all veterinary professionals. My name is Lisa Greenhill, and I'm the Senior Director for Institutional Research and Diversity at the AAVMC. So today's show is a kind of a bit of a do-over for us. We're really excited that our guests agreed to kind of come back on and do this show. This is our show devoted to issues related to learning disabilities and neurocognitive difference within the profession, and specifically within academic veterinary medicine. So we have three guests, and I'm delighted that they are joining us. We have Dr. Christy Orr from Texas A&M University, Regina Carey from the, let me make sure I get this right, the Learning Disabilities Association of Michigan, and Dr. Daryl Steele from Michigan State University. Hi, everyone.
Hi.
Hello.
Hi, thanks for joining us. I want to give you each, before we dive into our many questions, I want to give you each an opportunity to tell us a little bit about kind of how you got here and what you do, where you are, and why don't we start with you, Daryl?
Okay, sure. Again, I'm Daryl Steele. I am a learning disability specialist at the Resource Center for Persons with Disabilities here at Michigan State University. Been here at this location for just about 6 years now, and have done this similar work in the past at Southern Illinois University. So quite a bit of experience working with individuals with learning disabilities, and ADHD are the primary areas in which I've been focusing. So that's me.
Great. All right. Christy, why don't you tell us a little bit about you and what you do at Texas A&M?
Sure. So I am the Director of Disability Services here at A&M. I've been here for 18 years, so a lot of change has happened over those 18 years since we've been here. A lot of growth and different disabilities, different ways of doing things. I'm also the president-elect of AHEAD, which is the Association on Higher Education and Disability. So it's the professional organization for people who do what I do. And also, just a little side note, is that my dad is a veterinarian, a retired veterinarian. So I was the contact for our vet school for many years until I stopped taking students individually. And so that's also my connection with them.
Awesome. Bonus. And Regina, why don't you tell us a little bit about yourself?
Hi, everybody. I'm Regina Carey, and my background is special education. I've been doing this work since I was a senior in high school, really, so 30 years. And my husband is a veterinarian, so my life has been veterinary medicine as I followed him through his schooling and professional development. And I launched my own business, Carry On, which focuses on personal and professional coaching for individuals with invisible disabilities. And I have expanded that to women empowerment. So it's really a branch of everything that I've done as a part of the Learning Disabilities Association of Michigan. And I'm also involved at the national level.
Great. Thank you all. And thank you all again for joining us today. So let's dive in. So the first question is, what exactly are neurocognitive differences? Like what is that? We hear some terms like neurotypical or atypical and neurocognitive. Is that even the right kind of terminology? I'm going to toss this one to you, Regina. Why don't you tell us kind of what is the terminology for this kind of class of or grouping of difference in disability?
Well, I think when we talk about a learning disability, we talk about that as a neurological disorder, or at least that's kind of unfortunately the language we've been using, is that it's a disorder, and that perhaps we've pathologized it. It needs to be fixed or cured, and that doesn't happen. Neurocognitive disorders, diversity, is about differences in brains and brain chemistry, and the synapse is firing or not firing. And the frustrating thing about neurocognitive issues is that we can't see them. And so where you have someone with a physical disability, it is very easy to see what they need and attend to those needs. Whereas a neurocognitive or a learning disability can affect everything. It can affect a person's coordination. It can affect their reading, their writing, their mathematic ability, their speaking, their ability to take in information and write it down, the way they process things visually, auditorily. It covers the gamut. So, and no two people with a learning disability look the same. So that's another frustrating thing, because you can't say, oh yeah, I've had a student like that before. No, you haven't.
Mm-hmm. So what are some of, and Daryl, I'm going to ask you, and then you, Christy, to weigh in. What are some of the different kinds? I know that there's lots of different kinds of learning disabilities, but which ones do you, I guess, primarily see in working with vet students? And what are some of those kinds of struggles that these students and or professionals are kind of wrestling with as a result of some of these diagnoses?
Sure. So with me, for students who I work with who fall under these categories, are primarily going to, the diverse or the different terms that you'll see are particularly a math disability or a reading disability, and also writing. Traditionally, that's what it's been. But as of late and more recently, you also see terms such as like a nonverbal learning disability. You also have students who historically have had what we've identified as dyslexia, dyscalculia. So again, so the reading disability or dyslexia would represent some difficulties that students deal with, struggles they deal with printed material. So it could be difficulty with reading comprehension. It could be difficulty with reading fluency, whether that be the speed of the reading or actually decoding the words. So similarly, it could be the same way with math, or in a similar way the student can be affected. As Regina shared, a lot of times it's about the way the individual processes the information. Again, for me, it's always important to remember it's never about the individual's ability as much as it is the way the individual processes the information, the way it's being presented to that person. So those are, when we talk about learning disability, those are the areas in general that I will see, but they affect students in varying ways in the classroom and both in work settings. So again, it's always it may be in the areas of testing. It could be in lectures where there's material for the student to be able to read that's maybe on the overhead projector, or kind of dating myself, but on the that's being projected. So it can affect students in varying ways. But again, as Regina shared, it's always going to be different for each individual. So while I may be seeing two students who have both come in with documentation showing a learning disability in the area of math, the two students can be affected in two different ways, or they may process or deal with the information in different ways. Yeah.
Okay.
Yeah.
Christy?
Yeah, so I think I would just add, I think everything Daryl said is right on. The other thing I would add is just something that we're seeing more recently, or the last few years, would be an auditory processing disorder, which is just basically that students have trouble taking the information in auditorily and processing it the way that many people do. And so you would see that come in where a student may have difficulty being able to just listen to a lecture and then maybe take a quiz right afterwards, or be able to get the notes down correctly. And so they may need some assistance with actually getting accurate notes, as they actually may spend more of their time studying from written material. So they may need more so than actually the lecture to be able to learn the material. And then the other, which we consider a different category, but I think when we're talking about these issues, it's definitely an invisible disability that we see a lot. Hey, there's Daryl, I can see him. The other thing that we see a lot, and actually is our largest category of disabilities, is attention deficit disorder. So we consider it a separate category, but I think, in this conversation, it's important to remember that students who have ADHD, or what some of them call ADD, are students that we are seeing in very large numbers. And again, it's related to processing, along with being able to focus and being able to not be distracted and those kinds of things.
And it has nothing to do with their intelligence.
Absolutely.
Absolutely. Absolutely. Actually, we were just, before the show started, I was sharing with Regina that there was a podcast that I was listening to this morning called Parenting in the Rain. And it was talking about how to help your children who may be on the autism spectrum be successful. And the show featured Temple Grandin, which of course she's very well known in the veterinary world for her work with animal behavior and animal production. So I want to kind of learn a little bit more about ADD or ADHD, because I think that this is something that's kind of hot news. People kind of are asking, is it that we are really seeing an increase in the incidence of attention deficit issues, or are we just really much better at diagnosing ADHD? And kind of what does that process, even for diagnosis of some of these issues, what does that process even look like? So I'm not sure who to pitch this to, so feel free to jump in.
I think I think both sides of that are important to both acknowledge. Is it that we're doing better, or is there a higher incidence of ADHD? For us, we at MSU in the Resource Center for Persons with Disabilities, we categorize both learning disabilities and ADHD together. So I can't tell you the exact numbers between the difference between those that we have there are ADHD versus LD, but at the same time, that category has always been at the highest incidence among all of our populations that we serve. So in any case, though, one thing we do know is that more students are actually coming to college who have these diagnoses. So, and that's because there's a lot of things that are in place that allow those students to be able to be successful at a high school level, then come to college and still be successful. So offices such as ours, but then also instructors and resources on campus that are more open and more ready to be able to assist students who come to a university with a disability. So now students are able to see that this is something I'm capable of doing. Whereas maybe in the past, that wasn't always, it may not have always been a goal because the student may have been told that they were not college material for various reasons. Again, it wasn't because the student wasn't smart enough. It's just that the student maybe was not succeeding with the limitations or the barriers that have now been better dealt with. So I think it's a combination of maybe more students. It's possible there is higher incidence of the diagnosis, but I'm just not sure. But then at the same time, we know that these students are able to find more resources and able to really show their true ability once they do arrive on campus.
And I would add, I think one thing that it's a very complex issue, because along with the fact that I think there are more students diagnosed appropriately that maybe were overlooked in the past, which includes often females are often not diagnosed with ADHD because they may not have had the hyperactive behavior. And so they may not have done well in class because of their inattentiveness, but that it doesn't draw the attention of professionals. And so they don't necessarily get diagnosed. And so that can be an issue. There's more awareness, there's less stigma. We also know, unfortunately, that there are people who are being diagnosed inappropriately. And so there are physicians that people can go to, and they sometimes, in student populations, they find out who those are, and they can go and just say, I am having trouble concentrating in class. I think I have ADHD, and the doctor will diagnose them and give them a prescription. And so that is happening, and there's not a whole lot that we can do in offices like Daryl's and like mine to kind of try to really weed that out very well. We can't require extensive documentation for students. We do require that they do provide some sort of evidence that they have a disability, because we can't do that diagnosis ourselves, but we can't require every student coming in to go through a very extensive psychoeducational evaluation, which would ideally be what we would do to find out for sure that it's ADHD and not something else. But we can't require that, because then we might be missing people who really need services. And according to the law, the amendments to the Americans with Disabilities Act, we really want to make sure that we're not gatekeepers and that we're not keeping people from getting services that they need. And so offices like Daryl's and mine kind of walk this fine line of trying to make sure that we're getting services to students. And so that is some of what we're seeing with the ADHD diagnosis. And I hate to say that, I wish I could not say that, but it is true that there are some students who maybe are being diagnosed that don't necessarily qualify if they were to go through a thorough testing process.
Okay.
Right. And the bottom line, though, really is for faculty, if a student comes to you and has a visa or has a document saying that he or she requires accommodations, it is not the place of the faculty member to question the diagnosis or to look at somebody and say, you look perfectly normal, you got into vet school, why do you need these accommodations? That's never an appropriate thing. And regardless of how they come to us or how they get to the vet school, the reality is it's important to work with them and help them to succeed at the highest level because they're capable of doing that.
Okay. So, Regina, what does that testing, and each of you mentioned kind of the testing process for a diagnosis, specifically for ADHD, but what does, for folks that this is a totally kind of new space and we talk about kind of the documentation, what does that testing process typically look like? And I recognize that some people will be diagnosed quite young, they might get caught pretty early, and some may get caught later stage. And I don't know if there's a difference in the way that those testing pieces go, but can you talk a little bit about what does that look like for people who might not be sure?
Well, I wish we were in the time of the Jetsons where we could just do a body scan or something and say, yes, your brain is showing this and this is what's happening. But it's really very subjective at some levels because it's a questionnaire typically that is filled out. If a child goes into the doctor and says, I think I have this is my issue, the doctor is supposed to give them an assessment or a battery that goes to a questionnaire that goes to their teachers, that goes to the parents, where they fill out a multitude of answers to questions like, how are they, how do they pay attention when they're in school, or do they have difficulty staying still? They look at extreme behaviors and really subtle behaviors. So they assess and bring that back to the doctor's office, and then if they feel the need based on the assessments to move forward, then there's psychological and educational testing. And it's a long process, and it can be months before a child is or an adult is identified and gets the support they need.
Yeah. So I want to talk a little bit about kind of what are some of the positives attributes. I mean, we talk about these things as though they're disabilities because they're kind of not neurotypical, right? But we don't talk about how these things might be perceived for students, particularly high intellect students, that there really may be some kind of interesting gifts that come along with it, right? And so like Temple Grandin, for example, and the spatial awareness piece and kind of understanding shapes and things in a way that's very, very different from the neurotypical brain. So what are some of the maybe upsides, I guess, if you will, for having these kinds of brain differences?
One of the things that you mentioned, the intellect of students, one of the things that we talk about when we think about the students who arrive here at undergraduate and graduate level is that these are students who were admitted to the university without the university knowing that the person had a disability or a learning disability or any type of disability. So one, the person is very capable of doing the work. But in addition to that person having the intellectual ability, the person also has worked really hard to be able to reach these type of outcomes. In many cases, the students who I see are students who maybe are those who stay up late, still working on projects. And it's not at a deficit, it's at a level of individual wants to have a particular outcome. That person wants to be able to do her best or his best. And due to the issues related to the disability, or the differences in the way that individual deals with information, that person may, need to take more breaks or may be distracted at times, but at the same time, the project gets done or the work gets done. And it gets done at a high level of quality. One thing I like to think of, or another thing that I like to think of too, is that this person is coming with a different perspective on whatever the assignment or project may be, or that person's contribution to the group work or to the classroom. So because that person has a different background, different perspective, based on, in some cases, based on what that person has gone through to get to that point. So I would say there's diversity or a unique perspective in addition to the intellect and the hard work that that person puts forth. And one other thing I would say too is that sometimes I see with students who are diagnosed with ADHD, there's a level of some level of perfectionism that comes along with it. And again, this is not a negative thing because a lot of times, again, the project is done well and accurate. So those are things that I have seen commonly. So.
They're gritty. There's a lot of grit, which, certainly we see a lot of research talking about grit and resilience and the ability to kind of scale these issues. So I'm kind of curious, and this is probably hard to gauge, but Daryl and Christy, what would be your guesstimate, I guess, for the percentage of veterinary students who disclose and ask for accommodations?
So for me, as you mentioned, it's a little bit difficult. Regina and I were just talking. We don't have the control of the numbers, or we don't know the total number of students that are part of the veterinary college or vet med, and that's just because it's a separate department. I can tell you from our office, we have just under 20 or about 20 students who are registered with our office who are actually a part of that college. So I can answer it from that perspective.
Okay, all right.
Yeah, and I would say, I know overall, university-wide, we're around 3% of the students population is registered with our office. So that could be with any disability.
Sure.
And I think it's probably mirrored pretty closely with the vet school. It may be a little bit less. So when you get to any of the professional programs or graduate school, it's probably a little bit less than that as far as that actually seek services in our registered office. Now, we know that whether it's undergrad, grad, professional school, that there are students that do not seek services that could, which could be for a variety of reasons. Some are very positive. If they are getting everything they need and they don't need us, that's a wonderful thing. Sometimes it's not so positive. It's because they fear a stigma or they think it's going to somehow reflect on them when they, maybe it's going to be on their transcript, something, which it is not. But sometimes people have those perceptions and they worry about that. When we get into those professional programs, sometimes they worry more about that they don't want their classmates to know, or they don't want their instructors to know, because they think that might reflect on them when they're seeking a recommendation or that kind of thing.
Okay. So could both of you tell me, and I'm imagining, and so Christy, I'll ask you to field this. I'm imagining it's probably very similar at both of your institutions, but we certainly invited pre-vets to join in today and watch the podcast. So you get into vet school, yay, right? Everybody's kind of getting their letters right now, and so people are pretty excited. And then, okay, I've got this thing. Now what? So they're admitted. So then what? What do they do next to seek accommodations?
Absolutely. So I would early in the process. So even, as soon as you get your letter and when you decide where you're going to go, or if it's part of your deciding where you're going to go, I would contact the school. You can do a web search, look on their website and put in the word disability or accommodations. And there are different names for the different offices, so sometimes that gets a little confusing. But if you search for accommodations or disability, you should be able to find the office that's responsible for providing accommodations for students, all students. There's different models, so it could be that your accommodations go through a slightly different office, but there always has to be someone who's responsible for providing accommodations, and that extends into vet. So just because you entered vet school, those accommodations do not go away. We hear funny things like, oh, it's summer and there's summer school. We didn't know you could get accommodations in summer school. Of course you can. So those accommodations are available for all classes, no matter what level, no matter when they are occurring. So I would encourage you to seek out that website, look at the information they have, contact them if you need more information about how to get registered with that office to make sure that you have the accommodations that you need. If you don't know for sure if you need the accommodations or you have any questions, give them a call or go visit. Get all those questions answered even before you get on campus, so that way you know what to expect when you get there. I would ask some questions like, if you need testing accommodations, where would I be doing those testing accommodations? How does that process work? Because it is different. You know, for us, it's a little bit different in vet school than it is as an undergraduate in that same college, because the students take the tests at the vet school, because when you're in vet school, you're in class all day long. And so to get to our testing center would be a little bit of a challenge. But that may be different at different schools. So I would contact them early and get those questions answered and find out what the process is. Typically, if you had accommodations when you were an undergraduate, that information that you submitted to that office, whether it's a testing report or a doctor's letter, typically that's going to at least get you started with what you need. And then that college or university will let you know if there's something else that they want or if they have questions. We are responsible for interacting with every student on an individual basis. So we don't make blanket determinations. We'll want to talk to you, meet with you, figure out what it is that you need, and make sure that we're tailoring your accommodations to what your needs are.
Great, thanks. Anything to add, Daryl?
Sure. Yeah. So similarly, once you're admitted to the program, please do reach out to our office. We have two processes. You can call and come in, call and come in, or you can register with us online to notify us, and then we will reach out to you, and that begins the conversation. As I said before, I start as early as possible. The process is not always just an overnight process, but start as soon as you can. Once we get everything that we need, we'll meet with you, and then we'll give you the letter of accommodations. And with our vet college, we reach out directly to our liaison there. So a lot of things are happening with and for the students. So again, though, the main thing for me is to get started early. Reach out to us and get started early. And you can even reach out to us before you actually know that you're admitted, or even when you're thinking about which college you're going to go to. As that helps make the decision based on when they learn how the process will be and who they will be working with. So again, the earlier you start, the better, and the more questions you can have answered in a reasonable amount of time. So.
Okay, great. And I just want to make it clear for students who are interested in applying to vet school that disclosure is not a part of the admissions process. This is a completely separate process, and your application doesn't include, a place to, or it doesn't include a space for that, and it doesn't require you to disclose. Your application is reviewed just like any other application would be. So I think that that's important for people to know. So Regina, we've talked a lot about all of these different kinds of differences, neurocognitive differences. What are some of, I guess, the most common accommodations that individuals may receive or ask for?
First, I want to make sure that we have identification between a modification and an accommodation. And to modify is a bit more extreme than accommodating. So modifications means we're changing the language. We may be using different books or shorter assignments, weighted grading in different areas, exams and that kind of thing. That's not what students are asking for at the vet school level. They're asking to be accommodated, which means they might need a alternative way to get the information. And we've got a system in place for universal design for learning, which brings in assistive technology and allows them to use Kurzweil and some of the other text-to-speech programs. The environment is important. So if you are an easily distracted person, it behooves you to take an exam or a quiz in a quiet environment. So having an alternative space or having a little bit longer to take the exam. These are typically what students are asking for: extended time, separate environment, and a different way to receive the information, maybe recording the lectures, that kind of thing. These are not huge changes to the information. It's like putting on glasses so you can see more clearly. So it allows them to access the information at a level that works with their brains.
Great, great, great. So I'm kind of curious about, what do you say? Certainly, I travel to a lot of schools and folks are very supportive of students and we all love students, but I do sometimes hear a bit of pushback. Like, well, this is the real world and we can't accommodate everyone. And maybe this really does mean that there's some type of deficiency. What is, I guess, the appropriate tactful response to individuals who think that these kinds of accommodations really limit a student's professional preparation?
I think one of the things that we do is we talk more about what their concerns are. So from a faculty perspective, we don't want faculty or vet school professionals to feel like it's us versus them. And so we definitely are all on the same team. All of us are trying to produce successful students that are going to go out and be great veterinarians. So we're all in this together. And so what we really want to do is find out what those specific concerns are. So if the most common accommodations are exactly what Regina said: extended time for exams and a quieter testing environment. So when you're talking about being out in the real world, I want them to tell me how that would play out. So when in the real world would you be in that kind of environment where having been accommodated in the past would be a problem? So in my working world, I'm never asked to sit down and take a test in a noisy room or in a room with a lot of people in a certain amount of time. I don't think I've ever been asked in 18 years to do that. So I actually do most of my work on my computer in my office, or some people are in a cubicle. It's usually a quieter space. I usually have more like days versus hours to do work. So it's me managing my time to get it done. So, even more so with a veterinarian, they're mostly going to be hands-on out there doing the work. We're not asking for things like extended time on helping a cow have a baby. That's not what we're asking for. So we really try to delve into more specifically what those concerns are, and usually we can address those, because there are times when an accommodation is not appropriate, and that's where we work together to figure that out. So like the example I just gave, if it's surgery and you can't have extra time to be able, and I don't know all the terminology, but to tie off an artery that's spurting or something, that's got to be done in a timely manner. So we're not asking for extra time in that. We're talking about pen and paper tests or on the computer tests, and you're not going to have that environment when you're out in the working world. So we really try to look at what those concerns are and then really address them. If it is something that could be a problem in the future, then we need to look at whether the accommodation is appropriate or not, or maybe we need to do something different. And that's what we look at there. So it's very much a conversation between us and the faculty, and then with the student, depending on what the accommodation request is and how involved the student needs to be in that conversation.
Great, thanks. And Christy, we did get a question submitted, and you really kind of touched on it when you went into the cow giving birth. And that question was really the accommodations in classrooms versus clinics. And so are there any kinds of accommodations that might be appropriate for clinics for this grouping of individuals with disabilities, with learning disabilities or neurocognitive disabilities? Certainly there may be some other folks that have physical limitations in clinics that might go about doing work differently. But the question really is kind of, okay, if testing is one of the biggest issues, then by the time you get to the fourth year, kind of, what is that support? What's the support system like?
Yeah, so I would say for one thing, I just want to point out that there's no list of accommodations. And so if a student was struggling with clinicals who was in this population, we would really want to talk to the student about what the struggles were and try to figure out if there is an accommodation that would be appropriate. So definitely don't want to say yes there are or no there aren't. We would need to look at that and consider that and then make a determination. It is very rare for us to have accommodations in clinical settings for this population. As you indicated, there are some other populations where we do see more accommodations that we do. Not as much usually for this, but there could be a time depending on what it is. So if it's related to something, if they have some kind of note-taking component to their clinicals where they actually have to go back and process something and write something up and something along those lines, we've seen that like in vet schools, then it could be that an accommodation would be appropriate for that. And then we'd also be looking a lot at technology and whether technology would be something that would be helpful. So that way, it may be that they have a technology accommodation that they can carry with them into their professional life and they would still be able to accommodate themselves when they're done.
Okay, great.
I just asked my husband this question last week. I said, are there phone apps? Are students using their phones to access information? And he said, yes, there's a lot of apps that the students use. They have their phones with them all the time to be able to get to that information quickly. But one of the great things about clinics, the fast pace of the clinic is sometimes really great for those students who are more hyperactive or really like the action. And the cool thing about people with diverse brains is they can be really amazing in an emergency situation. That's when their brains really turn on. So they can focus and prioritize and lead, you know, tell people this is what needs to be done and let's do this. And they're great with clients, that face-to-face, you know, you get them in a room with people, amazing, because they're really good at interacting with people. They've had to be, because that's how they get that they advocate for themselves. So the clinics might really be a time for them to shine. And if there was one important accommodation, I would say make sure it's that you're getting with a supervisor, whether it's your doctor, your primary doctor, or a resident that you can meet with on a more regular basis to say, hey, how am I doing? Am I moving in the right direction? Am I thinking the right things? Am I saying the right things? What can I do better? So that you are continually getting that gauge during your rotation.
All right, great. So I'm getting a little bit of an echo here. I'm going to date myself a little bit. And so back in the day, for those of us who were around in the days of the Cosby Show, there was a great episode of Theo Huxtable being diagnosed with dyslexia when he comes to undergrad. He fails a test and his parents are very distraught and very disappointed. And it turns out that he has dyslexia, and they find all of this out in either a half hour or a 2-episode arc. So I'm kind of, and for folks that were not around for the Cosby Show, you can Google it. I'm sure it's on YouTube somewhere. But I'm kind of curious, not just in terms of veterinary medicine, but how many students do you see kind of get to undergrad and kind of find themselves in that type of scenario where they've been able to excel for those K through 12 years and then kind of find themselves experiencing more challenges without the same type of structure? Daryl?
So it happens quite often under our category. So I can't tell you the difference between those who come who have already been diagnosed versus those who come with a new diagnosis once they arrive at MSU. But it's very common for students to come in once they arrive at MSU, either now have to really deal with maybe what they've already thought was a disability, but still have those supportive factors going on around them, such as parents, teachers, siblings who are able to support them. But then they get to MSU or they get to a university setting, and now when they're kind of on their own, so at least the belief there is that they're on their own. Now the student does not have that that support around them. So now that student will reach out to us. So again, I don't necessarily have that number of those students, but it does happen for a great deal of students. So whereas I may register maybe 20 students a semester, maybe, up to maybe 8 to 9, possibly to half those students could be students who are new. Who have newly been diagnosed or are experiencing enough difficulty where they're asking, how do I find out if I have a learning disability or ADHD? But again, a lot of those students have excelled, have done very well through all those different techniques that student or strategies that student may have used to be able to be successful up until the point they get to a university setting. And now it's just that they need more support to be able to reach that same level of accomplishment. So.
Yeah, and I would agree. I think I don't have numbers because we don't really keep track of those stats, but it could be as much as half and half, students that were diagnosed before and then students that come in and are diagnosed, and that's with all disabilities. So, I mean, there are probably more students with learning disabilities that were diagnosed before than some of the other categories. But for those students, just exactly what Daryl said, and just to remember that those students that are coming in that were not diagnosed previously, for one thing, they probably have a very high IQ, and that's part of how they've gotten through is they're just very bright. And then they've also probably learned how to accommodate themselves just kind of through trial and error, done some different things that have worked for them. And, that could be, sometimes it's that their mom read their textbooks to them and they didn't ever pursue any kind of learning disability testing, but that was just kind of how they did things and they didn't really think about it. Or they've always chosen audiobooks, as a way to kind of get through, but never been officially diagnosed. The other thing to note about them, whether it's, even coming into vet school, some students have not been diagnosed previously. And for those students, if it's their first time to use accommodations, that's a process. So they don't necessarily know what works for them or doesn't work for them, or when we're trying to determine how much extra time they need, they don't really know because they've never really sat down and measured how much of a test do they finish when they don't finish, or that kind of thing. So sometimes there's some adjustment in accommodations as we go through and really try to figure out what works, partly because they've not used accommodations before, partly because it's a different environment. And it may be they've always had pen and paper tests and now they have tests on the computer or different things like that. So sometimes there's a process of determining and changing accommodations as they go through. And that's something that they work with our offices with Daryl's office and my office and other offices like that, is really trying to figure out what accommodations are appropriate. And that's our job. Once we determine them, as Regina said, when you get a letter or visa or whatever it is that you get from our office and email, those accommodations are determined by people who are experts in the area and really have worked to figure out what accommodations are appropriate.
Great, thanks. So I want to switch the topic just a little bit as we start to wind down. At AAVMC, we are very engaged in issues around wellness and emotional well-being, particularly of our students and certainly professionals as a whole. There's a fair amount of data that suggests that veterinarians may be at a higher risk of the incidence of suicide. But I've also seen some articles that individuals with learning disabilities may also kind of have some comorbidity issues related to depression and anxiety in particular, and perhaps some other issues as well. And I guess I kind of just want to touch on this a little bit about maybe Regina, you can kind of walk me through some of this, but how do we find ways of making sure that we provide kind of some 360 support for these individuals who may be struggling with not just this in a classroom setting, but some other general well-being issues as well?
I'm so glad you talked about this. I was just going to say, wait, there's comorbidity. It's not just ever one thing. And right. That's another interesting piece of invisible disabilities, I think, is that people it's not inherent as to what's wrong. And I think a lot of kids suffer for a long time because they think, what's wrong with me? What's wrong with me? So we have not only the neurological issues, but also depression, anxiety, bipolar, a lot of things that can, post-traumatic stress. There are a lot of things that come with it, and we need to be sensitive to that. So I know our vet school here at Michigan State University has got an on-site psychologist, somebody who works with the students, and it's important for them to know that these resources exist. And in the crazy schedule that is vet school, it is difficult to find time to make that a priority, because your mental health has to be priority. Or, you know, if you don't get that need met to feel loved and accepted and healthy, you're not going to be able to think in that higher order skill set, like Maslow's triangle. So remembering that we need to make sure that students know that these services are available, that there is time in their curriculum for breaks and movement, and to get, you know, with the animals. I think being with the animals is really healthy for the students too, and that's why you know, we want those early first and second years to get in on the clinics to be able to see the animals. But that is that needs to be a high priority in order to change the overall health of the students.
To Daryl and Christy, do you ever find, you know, I guess, how often do you end up having to also make kind of referrals to campus counseling services? Do you suggest that to students for additional support, or, you know, how does that work?
It is often a referral that we will make when students are dealing with it can be something the student outright says is a mental health issue, such as I've been diagnosed with depression before, but the student is not seeking services related to that, or even anxiety, or it could be even something happened back at home that does not necessarily pertain to what's going on campus, but maybe the loss of a parent back at home. And still having to be here at school or trying to stay at school or what have you. So we will make those referrals. It does happen quite often. And, you know, along with what Regina was sharing too, one of the things that is important for me to always remind students, or at least to keep in mind when I think about students, is that a lot of times the word disability is so scary for students. And for all those reasons that were discussed earlier, the students will shy away from services that will actually identify them as possibly having a disability or an additional disability. So the student may say, yeah, I have a learning disability and I've learned to be able to cope and deal with that. But then now to add an additional learning or disability, such as what may be called a psychiatric or mental health disability, and that can push a student away from services sometimes. So again, we try to support. There's a conversation right now, you know, like how do we handle that in terms of the referrals? Do we just make the referral? Do we walk students over to the counseling center when that becomes necessary? So all of that comes into play. But yes, that's one resource. And then any other resources, whether it be other campus organizations, or if it's a mentor or someone on campus that the person feels comfortable with, an instructor that the student has worked with in the past, that she or he felt that that person could always go to. And any other support groups that may be available on campus, whether that be whether related to the school or the college they're a part of, or even just something that's a good place for a student to be able to unwind. So any type of resources that we can make those referrals, we will when it becomes necessary. So.
Great.
Yeah, absolutely. I agree. And real quick, I just want to add also that I think that it's important for the vet schools to look at the climate that they are providing. So yes, it's good to have counselors, and we have that too, and referrals and all of that. But vet school can be a very competitive environment. And I think that it's important to look at what they can do to educate their faculty and their staff about disability issues and also mental health issues, and then also the other students, because sometimes the students can be not very supportive of each other. And I think anything they can do to try to improve the climate as far as any issues, I mean, not even just for students with disabilities and mental health, but just the stress level that's there, I think that is really important for them to address.
Great, thank you.
You know,
So as we wind down, I've got a question for each of you to kind of ponder and give some sage wisdom as we wrap up. What advice would you give to professors or professionals working with individuals who have learning or neurocognitive differences, learning differences, or any of these kind of types of conditions, and what advice would you give to those students who are in vet school with these conditions? So
I'll start.
who wants to go first?
I'll
Yeah.
go first. Okay, so because then I'm out of the way, I get to say the easy one. For both groups, my big thing, because I work in the Disability Services office, is make sure you use your resources. So that's what our job is. Daryl's job, my job, everyone like me. This is what we do. We go to professional development. We learn about this. We've worked with students. We know what those individual students need, and for students, we know what other students have experienced. And so I think the most important thing is just to connect with the office that's the resource for you and make sure that for students, you're talking about what your needs are. Let us know, everything so that we can make sure that we're considering what to do as far as accommodating you, and we can walk you through that process. And then for faculty and staff, we're a resource for you too. So I really want to make sure that if you get that letter and you don't know what that means, or you have questions, that rather than go back and kind of drill the student, although it's good to talk to the student if that's helpful, we don't want to drill the student or make them feel like they've got to explain themselves to you. That you can always call the office that's produced that letter and ask. And we'll provide the information as appropriate, and we're on the same team. All of us, student, faculty, and staff, are all wanting student success. So that's important to keep in mind.
Great. Daryl?
yeah. Yep, I definitely have to echo what Christy just said. We are a resource, and that's what we're here for. Along with that, ask questions when questions do arise. If for faculty who do not feel comfortable maybe asking certain questions of students, definitely raise them with us. And we know better of what questions we can answer and what questions we cannot answer, and how we should answer those questions. So definitely reach out to us. Students, make use of us as a resource. Your goal here is to do the best you can and to come out and become a vet. So come out, do that, but make sure if you need the resource, use it. Again, I ask that you do not hesitate or shy away from using resources when they're available. Like the idea or the thought that an individual may have a disability sometimes may push an individual away from an office or a resource like ours. But that's what we're here for. And then there's enough students that demonstrate that we are necessary. So again, you belong here, you're accepted. So now it's just using all the resources that are available to make sure you thrive while you're here. So.
Great. And last but certainly not least, Regina.
My mind is spinning. Okay, so for faculty, keep an open mind. Be creative. Stay curious with your students. Learn technology. It's not going anywhere. It's only going to get faster, better, stronger, and more widely used by everyone. So staying on top of that. If you've got a student who struggles or doesn't speak up, give that student a heads up the day before class and say, tomorrow we're going to be talking about this topic, and I'd love to start it off by asking you this question. Could you think about it tonight and be ready tomorrow? It's a great way to help somebody shine and give them the processing time they need. Keep your expectations high. These students want to succeed. They're smart and they can. So finally, for faculty, avoid telling a student generic, you did great or good job, because the student needs to know specifically, what was it that I did well, because I want to do it again. So be specific with your feedback. For students, you came to vet school for a reason. And I know that fitting in seems like the best way to be, but fitting in is a short-term strategy that doesn't benefit you. Standing out is going to benefit you. So know what you do well and use that. Use that through all of your professional training, because that's why clients are going to come to you, because you stand out from the rest. Remember that.
Awesome. This has been a great show. Thank you so much, the three of you, for agreeing to come back and give us a bit of a do-over. I actually think this was even better than, than the one that we attempted to do a couple of months ago. So thank you so much. And for our viewers, be sure to stay tuned. I'm delighted to announce that the next podcast will feature our deans from the British Isles, and we will be talking with Glasgow, Ireland, Edinburgh, and London. I'll be recording live from sunny Naples, Florida on February 2nd, and the topic will be Brexit diversity in academic veterinary medicine. And so we'll be talking about how the Brexit vote from last summer may be affecting the colleges in particularly in Scotland and London. So be sure to tune in February 2nd. And for now, this is the end of this podcast. Thank you so much for joining us. Thank you again to our guest, and have a great evening.
Thank you.
Bye.
Bye.